Now, I've got some questions that follow up on a question on notice in relation to myalgic encephalomyelitis and chronic fatigue syndrome. I've got the question on notice number for you. We did
for the TGA, sorry?
I don't necessarily think it will be for the TGA. I'll give you the reference number. It follows on a list of questions that we asked in the previous outcome that also now need to be asked in this outcome. So the number is SQ26001295. That's the reference number for the question. And the department advised in the answer to this question on notice that Australia currently has no clinical guidelines for MECFS, no formal interim guidance, and no assessment framework of workforce capability. So my question is, given that we have GPs as the main gateway for diagnosis, for treatment, for disability supports, what assurance does the department have that clinicians are receiving appropriate training and using evidence-based reference materials while the national guidelines are under development?
Does the CMO want to start off here, or are there others in the
Professor
room?
Kidd, maybe you want to give us...
Happy to start. Yeah. And as we mentioned this morning, Senator, the National Health and Medical Research Council are developing the national guidelines, which you know about very well. These will be clinical guidelines which will assist all clinicians, but including, of course, general practitioners in the diagnosis and management and ongoing care of people who've been diagnosed with ME CFS, people with long COVID and people with other related conditions. As I mentioned this morning, one of the really essential elements of the development of this work is the close consultation with the peak bodies and with people with lived experience, ensuring that their voices are central in shaping care. As a GP who's worked for almost 40 years and has worked with many people who've been affected by this condition, I look forward to these guidelines coming through and getting some consistency. Having said that already, the Royal Australian College of General Practitioners has a number of specific interest groups which are bringing together doctors who have a strong interest either through the patients they're seeing or through personal interest in looking at developing further standards for care and also for the ongoing education of the workforce.
Yep. Thank you, Professor. Professor, do you have more to add to that?
Hi, Steve Westling, CEO of NHMRC. I think most of it has just been said, but yeah, we are in the process of developing the guidelines, and the evidence that we have gathered for those guidelines is currently out for external assessment. And once that external assessment has been done and the guideline committee develops further the guidelines, they'll go out for public consultation next year. So it is a bit of a process, but we do want to get it right and we want to get all the evidence we possibly can.
No, I understand that. I think my concern, I guess, is that we've now acknowledged we need new guidelines, which is great. We're doing the work to make them, which is far past time that we do that. There are some materials that can be drawn on, but the concern is around currently as we are, what the department can draw on to assure itself of the basic qualifications or competencies of the gateway practitioner, if you like, in many of these spaces. Has the department sought advice from the AMC, the AMA, the RACGP, the RACP regarding the extent of ME CFS training provided to clinicians, the resource material recommended to clinicians, and whether those materials align with evidence that is being considered through the guidelines creation process? And if not, how does the department then assess whether the workforce is adequately equipped currently to manage MECFS?
Well, certainly, I'll let the Chief Health Officer answer some of that. But certainly in terms of the work that we're doing, we have consulted all of those organisations and sought and stakeholder input into the process and into our committee. And in fact, our committee contains members of a number of the organisations that you mentioned.
Yes, I do understand that. My question goes to in the interim. So we're in the interim between where we are now and actually having the new guidelines that are urgently needed. So in the interim, what the department has, whether the department sought advice from groups like the RACGP or the RACP regarding basically what they provide to clinicians to make sure that it aligns with the evidence that is being considered by the NHMRC as you work through the guidelines.
Senator, we provide funding for GP training, and the mandatory endpoint of that is registration as a specialist general practitioner with the Medical Board of Australia, which does delegate the accreditation of education programs that lead to registration as a specialist general practitioner to the Australian Medical Council. We're happy to check to see whether or not we've raised this issue with either of the two general practice accredited training bodies, so it's RACGP but also the Australian College of Rural and Remote Medicine, to see what content they have about this particular issue at the moment, and happy to raise with them whether or not there needs to be any changes while the guidelines are under development.
Excellent. And I've just got the wrap-up look from the Chair, so I'll just sneak in one last brief question, which is whether I can confirm that clinical guidelines for ME CFS they're still currently not expected until March of 2028, is that right? The updated guidelines?
That is correct, yes.
That's the date? Okay.
Yep.
All right, well then I won't push my luck any further. I'll leave it there.
Thank you very much, Senator Steele-John.
Authorised by J. Steele-John, Australian Greens, Canberra.